we've seen this, you go to your doctor, there's a little like notepad and there's a clock and something else with a pharmaceutical brand. So obviously that's a gift on their table. Going right up to, here is a trip to Europe for a conference, completely free of cost, paid for by the pharma company. Now, Dolo is paracetamol, and it's again a very easy over-the-counter sort of drug, but then it could, right up till cancer treatment, everything. And I think one thing our audience should understand is that one drug would be available at 5 different brands for 5 different price ranges.
Yeah, absolutely. And of course, Dolo is paracetamol of commonly used. Perhaps in paracetamol, if you compare brands, you may not find very wide differences. But when you go to some of the specialized drugs, including some of the injectable antibiotics, and I always have given this example, there are some antibiotics I use or people use in hospital practice, which are strong but effective antibiotics, and there the difference of one dose can be to the extent of 2,500 to 3,000, and there are typically 3 doses a day, and you often take it for 8 days. So you can do the math and see that shifting a brand can save a person maybe 50,000 or 40,000 rupees. Now, in this debate, of course, as I said, first of all, there is the patient interest. There is also an issue, which is that often doctors say that, look, we do receive some form of gifting and support from the pharma companies, but we don't get influenced. But actually the evidence up to now clearly shows that they do get influenced. There are people who have actually tracked prescription practices, looked at when medical associations have been given money and grants and shown upward swings in prescription, etc. So this is not about individual morality. This is about the fact that it works at a slightly subtle level. When you have in your clinic something staring at you, a calendar with a name, it obviously is subtly working on your prescription practice, and therefore there is a need for third-party intervention.